Hello everybody, I am Dr. Neeraj Goyal, laser laparoscopic general and robotic surgeon in Max Hospital, Patparganj, Delhi and Vaishali. So today I am going to talk about a very common problem called as piles or hemorrhoids, or in Hindi Desi language it's also called as bawasir. Piles are dilated vessels in the rectum which bleed without pain. So piles develop because of chronic constipation, and that means sitting for longer duration at the toilet seat. We should not sit for more than 3 minutes, and straining at defecation. We should not strain too much. When we do this over a long period of time, that is years together, then they develop. Symptoms of piles are bleeding. Fresh bleeding, bright red blood in the form of drops or jet of blood with no pain at the time of defecation. Conventionally, the surgery has been the treatment for piles or hemorrhoids, and that means removing them, and then the wound heals gradually, which used to be a very painful period for 2 to 3 months time or so. But now recently we have got a very good technique for surgery for hemorrhoids, and that is laser, diode laser. So the advantage of diode laser is that we don't need to remove anything, we don't need to cut anything, we don't need to use any suture or thread. We only need to fulgurate this. In simple language, I will say it is like putting acid in the root of a plant, and the plant gradually dries up and falls off. This is what, and this is how we treat piles today. So laser is a light beam, a specialized type of light beam. It is a collimated beam. The advantage of laser is that it dries up the tissue, evaporation. It does photoablation and photocoagulation. So protein in the tissue gets denatured, the hydrogen bonds are broken and water evaporates. And the laser energy is not absorbed by normal tissue, it is absorbed only by RBCs, red blood corpuscles, which are contained inside the blood vessels. And therefore, it is very specific therapy. It just hits the right tissue, it gets absorbed, and it leads to complete regression and fulguration of the piles mass, the tissue. So it's, I will say, a magic wand. It's a boon for the patients. No cutting, no removal, no suturing, yet we are free from piles. Since we are not making any incision, we are not removing anything, so there is no raw area. There are only 3 pricks, like taking blood samples from arm or any part of the body, just like an injection. So patient can go away, go back to his place in the same evening. That is a daycare procedure, you can call this, or maximum the next day patient can be discharged. Recurrence is possible. Why did the piles develop in the first instance? Because of the bad bowel habits for many years. So lifestyle changes are required. Adequate sleep, plenty of liquids to be drunk together. So orally we should take a lot of liquids, any liquid. I am not saying water, any liquid. And diet, which is helping in passing motion, purgatives, rather than constipating things. So if we take care of these things, and again going for the loo when you have so much of pressure, that is the most important thing. We should not look at the clock and then go for defecation, because this is only in such time that we will need to strain or sit for longer period. That's how we can prevent this. Plenty of liquids to be taken orally. Secondly, food items like non-vegetarian food. Tobacco is a strict no. These are 2 biggest enemies of bowel habits, non-vegetarian food and tobacco. In addition to this, any food item which is not helping in passing motion easily. It differs from for different people. For example, banana is not a good thing for passing motion. It causes constipation. Although it is also a good fruit, we should take this, but in moderation. Second, all those food items which cause purgation, like papaya, chiku, maybe mangoes or plums. Good sleep, and again remaining at rest, at peace mentally. Stress which is in our mind is again the biggest killer. There are a few problems where only surgery is the treatment. Medicines cannot cure that. They can only prolong, they can just slow down the process of disease. So it is not an emergency surgery, but as early as possible we need to get this done. So my advice is, like updation of all the technology, all the things in the world, same way development has happened in the field of medicine and surgery also. Our medicines, our anesthetic techniques, the laser for hemorrhoids for example, they are so fine, so refined that you don't need to be so scared. In the end, I will say any disease is bad, so are these. These are highly underreported diseases because of fear, because of shame, because of the area it involves, and I will say not a very good treatment available till recently. But we are fortunate today that we have got laser for treatment of piles. So you can be assured, if you take precautions, you will not need to come to a surgeon or a doctor. But if we have it, then it is better to reach the surgeon earliest, because there are stages of piles. If we delay, we will progress to the next stage. So better we should not reach there and get the treatment in time. That will be wise. Stay happy, stay healthy. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.